Today is talking about STIs, that's sexually transmitted infections, and infertility. How can these sexually transmitted infections cause infertility? You know, the one thing about sexually transmitted infections, it is that they don't present with symptoms. You just see it coming at the complicated part. When all the damage has already been done, that's when you start feeling these symptoms. So it is very important we know what to do at this level. So stay tuned and do not miss this episode. You're all welcome back to Talk Pregnancy with Dr. Noella, where we'll tell you all about pregnancy and other women related health issues. So if you're new to our channel, please click the subscription button so that you're not going to miss out on any video. So today we are talking about sexually transmitted infections. How can they cause infertility and what can be done? Now, what are sexually transmitted infections? They could either be a virus, a parasite, or a bacteria. Viruses, we talk of herpes simplex virus, hepatitis B, HIV and AIDS. Parasites, we talk of trichomoniasis, and bacteria, we talk of syphilis, chlamydia, gonorrhea. But now, what are the most common sexually transmitted infections that cause infertility? They are chlamydia, gonorrhea, and syphilis. These ones, especially chlamydia and gonorrhea, these are the most common causes of infertility in a woman. There is one thing we have to know is that once you are infected with this chlamydia or gonorrhea, they hardly present with symptoms. We say it is asymptomatic. And when it is asymptomatic, this means that you will have the infection in you and you will not know that you have it. And it is there causing trouble, damages. So it is very important. Once you do the test, early treatment is paramount. So now, what does this sexually transmitted infections do? How do they cause infertility? They cause what we call pelvic inflammatory diseases, that's PID. What are the pelvic organs? Uterus, the tubes, the ovaries, these are all pelvic organs. So once you have an infection, it migrates up. You can have an infection. Once you have these sexually transmitted infections, it starts from the vagina, goes to the cervix, to the uterus, goes to the fallopian tube, to the ovaries, and to its surrounding, causing inflammation and damages to these structures. The first thing with these sexually transmitted infections, most especially chlamydia, gonorrhea, they have high affinity for the tubes. Once you are infected with chlamydia, it's like the first place that they run to go and start affecting is the tubes. They just go to the tubes. It's like they just love the tubes. So they just go to the tubes, cause infection, inflammation. And when this is occurring, that's like causing a wound inside your fallopian tube. Is destroying the cilia, because there are cilia that are present in the fallopian tube that helps to move the fertilized egg to the womb. So once this is being destroyed, once the egg is being fertilized, it does not move because that cilia is not there to move this fertilized egg. So it causes destructions of those cilia, causing wounds in their place. Then scars. Once scars are being formed, it can cause a blockage of the tube, either partial or complete blockage. So that's why it's advisable women who are sexually active, that you've started having sexual intercourse, it's always important to screen yourself often. The Center of Disease Control recommends screening after every year, especially in women less than 25 years of age. Once they do this screening and you discover that it is positive, you treat immediately before it is causing these damages, because once these cilia are damaged, you cannot put back another cilia, and it's not going to grow back. It is already a scar which has been formed. It's just, for example, if you have a wound in your hand, people who are hairy, you have a wound in your hand, for example, you see a scar there, you see that hair does not grow back on that scar, that place is damaged totally. It's not like another hair is going to grow back there. So it's very important that we don't lead to these conditions where the destruction has already occurred. So how does it cause infertility now? If the tubes, once it has affected the tubes and they are partially blocked, what can happen? The most common thing that can happen here is ectopic pregnancy, because this fertilized egg, before it wants to pass, there will be a blockage. There's going to be a blockage at the tube, and it's not going to pass. It's going to remain there, then causing an ectopic pregnancy. How can you know you have a blocked tube? It is very important we do the test, which is called the hysterosalpingography. Many women, when they come to consult and they talk about the test which is done, they say they have done the pelvic ultrasound and everything was normal. No, a pelvic ultrasound is not equal to an HSG. That's the hysterosalpingography. How is this test done? It is done midway between your cycle. How is it done? A tube is inserted into a woman's vagina, and a substance which is called a dye. A dye is something which can be used in order to trace the pathway of something. So it checks the patency of the tubes. This substance is being injected into the woman through that tube. It passes through the uterus, into the fallopian tube, and inside, and it spills into the abdomen. So what happens is that at each step, pictures, x-rays are being taken. After this second, we know it is at the level of the womb. After this time, it is at the level of the fallopian tube. After this time, it should be spilling into the abdomen. So different pictures are taken at the various times. And now, if it reaches this point where it ends only at the level of the womb, it does not spill out, it does not go through the fallopian tube and spills into the abdomen, we say the tubes are blocked. So it means that the tubes are blocked, and this dye which has been sent, this substance which has been sent, has not spilled out into the abdomen. So therefore you have a blocked tube. This is how we diagnose the patency of the tube. I will not with an ultrasound scan. This should be taken note of. Once this is diagnosed and you see that and the tubes are blocked, management is what we call a laparoscopic surgery. During this laparoscopic surgery, it uses a small instrument where you get into the abdomen, and here a camera is being used and seen inside you. So if it's that there are adhesions, they can go and destroy these adhesions. If there's blockage, they go in and they actually break up these adhesions, these scars. But if they are, and this is just for ones which are small and maybe light or not too tight. But ones which are large, it will be difficult to remove. And once they remove or force and remove this kind of ones, what happens? It forms this scar, and there's a high risk of you having an ectopic pregnancy. So in this case, when we have large scars, destroying or removing these scars is very difficult. So this is where we advise women to do the artificial insemination. That's the artificial method of contraception. That is the in vitro fertilization. It is very important that women who are above, who are sexually active, who have multiple partners, protect yourself using a condom. Please, if you're on any method of contraception and you are not using a condom, then you are exposing yourself to sexually transmitted infections, and we have just seen the repercussions of this. So if you are out there, do your screening for your sexually transmitted infections. Then you are being managed, and when it is identified early, these damages have not yet been caused, because once your tubes are damaged, once a scar has been formed, it's not going to form back. We usually recommend that once you're treating yourself, alongside you treat your partner, and during that period, no sexual intercourse. If you want to have sexual intercourse, you should use a condom. Why? Because if your partner's own is resistant to the treatment and yours, and you get treated with yours, you must make sure that you treat yourself completely and your partner's own to treated completely, and at the end you do the test and see that it is negative before you go ahead. Why? Because if one of you might be resistant to the treatment, so not everybody is the same. You might react differently to a treatment, and once you are treated, your partner is not completely treated or his own is resistant, you will take back this resistant gene, and at the end it is costing you treatment. You hear people saying, and they have treated me several times and I'm not getting pregnant, and what is happening, or sometimes they do the test, it is only positive. These are the kind of scenarios. Once you change your partner, do a test in order to protect yourself, to know if you have the infection early enough before these damages are being caused. So once you have a blocked tube, it is very, there are times that if it is early and it is not too large, if it is small, they do a surgery and remove these adhesions and open the tube. But if it is large, you are advised to do an in vitro fertilization. So if this was helpful, give a thumbs up to our video, and if you want to have a private chat with me, if you want to consult, you can click on the link below and book for a consultation. Thank you very much, and God bless you all.